Good morning, everyone. Today in this video, we are going to discuss about health education and principles of health education. So these are the contents of my lecture. Introduction, definition of health education, objectives of health education, communication processes, and main principles of health education. So the word education derived from Latin word which means to bring out and to lead. Health education is imparting information about health, diseases, causes of diseases, and how to prevent it. So, this will motivate the recipient to use the information provided and it helps them in preventing diseases. So, definition for health education was given by National Conference of Preventive Medicine, USA. According to them, health education is a process that informs, motivates, and helps people to adapt and maintain healthy practices and lifestyles, advocates environmental changes as needed to facilitate this goal, and conducts professional training and research to the same end. So these are the objectives of health education. We have three objectives. First one is informing people. That is a cognitive objective. The second one is motivating people. That is effective objective. And the third one, guiding into action. That is a behavioral objective. The next is communication process. So this flow chart shows the processes in communication. So sender, message, channel, receiver, and feedback are the components of communication. So sender is the person who is giving the health education. Now I'm the sender. Message is what is I'm talking now, and the channel. What are the things I'm using to view this lecture? Receivers or the audience of this video, and feedback. What are the feedbacks you after listening to this lecture? So all this together forms the communication. In health education, we'll be using it. The effective health education will be the one in which we are using every part of this communication in a proper way. Next, we will see the principles of health education. We have 12 principles of health education: credibility, interest, participation, motivation, comprehension, reinforcement, learning by doing, known to unknown, setting an example, good human relations, feedback, and community leaders. So, this is a mnemonic to remember the principles of health education. Dr. or Line went to Frankfurt to get his PC2. So all the dental students or medical students know what is PC2. That is a professional certificate too. So Dr. Orline is a person who completed his medical degree and he went to Frankfurt to get his PC2. Like this, you can remember the principles. So learning by doing, that D are reinforcement, good human relations, that are community leaders, interest, motivation, setting an example, feedback, known to unknown, participation, comprehension, and credibility. Dr. Harline went to Frankfurt to get his PC2. Like this, you can remember the principles of health education. Then we'll see one by one. First is credibility. Whatever you are teaching or whatever you are informing the people, that should be credible, and that should create credibility among the participants about the speaker. It should be scientifically proven and it should compare with culture and social goal. The second health education principle is interest. Our talk should be interesting so that the people will listen to it. It should be based on the felt need of that population who are listening to a lecture. That is very important. The third one is participation. So we should make the audience to participate in the health education session. So when they are participating, participation is more, they'll be listening to it. That will lead to accept the information we are giving. So we can also use some group discussion and panel discussion to make them participate in our session. The fourth one is motivation, the fundamental desire for learning in an individual. So that is very important in health education. That motivation should come after our health education thing. So we have two different types of motivations. They are primary motives and secondary motive. Primary motive is inborn desire, and secondary motive is result of outside forces like teenagers aesthetic. So if you are talking about aesthetic things, they'll be more motivated and listen to our lecture. And for adults, they think everything in terms of money, economics. That is very important. So to attract elderly people or the adults, we should talk in terms of money and economy. So that is very important. So that gives a motivation. So that leads to accept the concept. The next one is comprehension. Comprehension is before talking anything, you should understand the level of understanding of the receiver. That is very important. You should determine the level of literacy and understanding of the audience. So whenever you are going to some rural area where people are not very educated, you should talk based on their understandings. You should not tell any medical word or in language which is not known by them, and some strange words should be avoided. For example, eat food items which are not carcinogenic. This word carcinogenic is not a common term. So these kind of words should be avoided when you are going giving health education for layman. So that is called comprehension. That should the health education should be based on the level of understanding of the receiver. The sixth one is reinforcement, repetition. You should be repeatedly telling the same and same so that they will understand it, and it helps like a booster dose. So it helps them to remember it. The next one is learning by doing. Along with the lecture, you can use some extra activities. Some activity based learning is very important. So this helps to understand the concepts very well. Next one is known to unknown. Like first, before starting the session, you should understand the level of knowledge in that particular context. So that only you can start from that. So you know this much level. So from this we are starting. But these after that in the later time you can tell them the things which are unknown, which are not known by them. So this helps in adding more information to the things which they knew before. Next one, setting an example. If we are giving tobacco cessation counseling or awareness, you should not be a smoker. If you are a smoker and if you are giving a tobacco cessation, that's contradicts. So you should be an example before giving any lecture. Next one is good human relations. Uh, you should give your health education in a friendly manner so that people will ask doubts and clarify their doubts. This is very important. Next one, after the session or in between the session, you should get the feedbacks of the participants so that you can improve yourself and you can clarify their doubts also. Then the community leaders. So before going to any places for any health education, we can contact the community leaders, people who are the head of the village or the headmasters, anyone. With them, we can go and we can give the health education. So when you are going with these leaders, that will create a good rapport with the community. And one more thing, whenever this community leaders telling something to the particular society, they will listen to it than the people who are coming from other places. So this is very important. So these are the 12 principles of. First, the definition. Health education is a process that informs, motivates, and helps people to adapt and maintain healthy practices and lifestyles, advocates environmental changes as needed to facilitate this goal, and conducts professional training and research to the same end. There are three objectives: informing people, motivating people, and guiding into action. Then the principles: credibility, interest, participation, motivation, comprehension, reinforcement, learning by doing, known to unknown, setting an example, good human relations, feedback, and community leaders. So, for further reading, I suggest Soban Peter Essentials of Preventive and Community Dentistry, 6th edition. Thank you.